Aspirin versus placebo. Definition.
Toxemia or preeclampsia is one of the more common disorders that occurs in pregnancy. It's a disorder that's unique to pregnancy. It's associated most commonly with blood pressure elevations, edema or swelling, taking on extra fluid, and spilling protein in the urine. Those are the three classic symptoms. There are other symptoms that can go along with it. Typically, it tends to occur toward the latter part of pregnancy, and the only real way to treat it is delivery. Sometimes toxemia or preeclampsia, and the terms are generally interchangeable, occurs early, and you can buy a little time, but you have to watch very closely for its progression, and if it progresses rapidly, then the only treatment, the only alternative is to deliver.
Proteins in the urine, what would those symptoms be?
Sometimes women don't have any symptoms, and that's the problem. Many times women will describe a sudden increase in their swelling or a sudden increase in the amount of fluid that they feel like they've taken. Some women describe a headache, some visual changes, some upper quadrant pain they'll describe. But many times women don't have any symptoms whatsoever.
Preeclampsia is a pregnancy complication characterized by high blood pressure and signs of damage to another organ system, most often the liver and kidneys. Application in nursing aspirin placebo. A placebo is anything that seems to be a real medical treatment but it isn't. It could be a pill, a shot, or some other type of fake treatment. What all placebos have in common is that they do not contain an active substance meant to affect health. Aspirin is sometimes used to treat or prevent heart attacks, stroke, and chest pain. Angina. Aspirin should be used for cardiovascular conditions only under medical supervision.
31-year-old Reza Bari developed preeclampsia late in her pregnancy. I had no idea what it was, let alone I didn't know what was happening to me or why my blood pressure was so high. Women with preeclampsia have dangerously high blood pressure and protein in the urine after 20 weeks of pregnancy. Now, the U.S. Preventive Services Task Force is recommending a low-dose aspirin for women at high risk after 12 weeks in pregnancy.
Low-dose aspirin every day lowers the risk of preeclampsia by 24% and lowers the risk of preterm birth by 14%.
The recommendation is based on a review of the latest research. Preeclampsia is the leading cause of death in pregnant women.
Once preeclampsia happens, we really don't have any kind of great treatment other than delivering the baby, and sometimes we try bed rest.
Women are at high risk if they've had preeclampsia in a prior pregnancy or if they have a history of diabetes, hypertension, or kidney disease. Bari, who was put on bed rest and delivered her daughter full term, says she would take aspirin to prevent preeclampsia in future pregnancies.
There's no, side effects to my baby? Absolutely. Because I don't want to deal with it again.
It's been 6 weeks since Bari had her baby, and her doctor will monitor her blood pressure until it returns to normal. Alexis Christophorus, CBS News, New York.
Aspirin, deadly low dose aspirin 81 milligrams in middle and late pregnancy can significantly reduce the occurrence of preeclampsia among these women. It can lower the risk of preterm birth or low birth weight resulting from the pregnancy-related conditions. Cons. Use only if clearly indicated. First and second trimester. Avoid use during third trimester as it may cause premature closure of the ductal arteries. If used in the first and second trimester, it should be used at the lowest dose for the shortest duration possible. First, placebo. Many causal complaints can be dealt with by inactive placebo treatments, which they will save a significant amount of time and money. Carries benefit of the drug, but with little to no risk of drug dependence comparing to actual treatment, and in some cases can work as well as drug when it comes to pain, anxiety, headache, and depression.
What if you found out the medicine your doctor's been giving you wasn't proven to make you feel any better, but yet you did get better? This is called the placebo effect. It's one of the strangest and least understood phenomenons. It's most often used in pharmaceutical clinical trials to prove the efficiency of new drugs. But what's interesting is that it also occurs in animals. Studies observing Siberian hamsters revealed that when hamsters were made to believe it was wintertime, their immune systems went to a more dormant state to preserve energy. For some reason, the placebo effect doesn't work unless there's a source of external influence to initiate a sequence of events. What's strange is the external influence may differ. The placebo effect is bigger when the pill itself is bigger, or when you take a capsule instead of a pill. And there's even a placebo surgery, which outperforms both combined. But that's not all. Placebos can also be addictive. In one study, a group of women took placebos for more than 5 years. Surprisingly, 40% of them experienced withdrawals afterward. Placebos are geographically sensitive, meaning that their effects differ depending on where you live. For example, using placebo to treat ulcers worked better in Germany than anywhere else in Europe. And when Valium was tested in France, it outperformed the placebo. But when tested in the United States, it failed the test. And as our medical technology improves, our faith in medical professionals improves. With this said, the placebo effect has been shown to simultaneously grow. If you liked what you saw, make sure to subscribe for more videos. And if you want to keep learning, please head over to my channel. And with that said, thanks for watching.
Cons, it isn't considered ethical to prescribe placebos when there is a better treatment. Placebos involve medical professionals receive their patients, which is also considered unethical in modern medicine because patients will start to misuse medical practitioners. Risks and delay in the treatment and diagnosis of a real medical condition. Conclusion. Finally, the placebo is a good treatment in many situations or cases, but it isn't effective in all cases or diseases. However, we have the aspirin, and it is effective in many diseases, but in pregnant women is more difficult because the negative effect is more probably for the mother and son. So we must be care the administration of this pill.